Hi, I'm Todd Didier, Communications Director for the Primary Care Collaborative. Every month, the PCC recognizes outstanding leaders from across the country who are helping improve the health of our nation by strengthening primary care. This month, we're thrilled to recognize Christina Bell, Senior Director of Healthcare Advancement at the National Alliance of Healthcare Purchaser Coalitions, an organization dedicated to lifting up the voices of private employers and purchasers that are committed to improving the American health system. Christina, thank you for joining us.
Thank you, Todd. Thank you so much for having me.
Could you tell us a little bit, how did you become a primary care champion? Why are you passionate about strengthening high quality whole person primary care?
Identifying myself as a champion did not become evident until I seen, the devastation of what not having access to primary care professionals can do to a community and their overall population health as a result of, the work that we do through the National Alliance and through the regional coalitions that we work with. And, in terms of addressing like social determinants of health, health equity, the consolidation of independent physician practices, and also as we learned about physician burnout and how that interconnected with mental health. And then lastly, I would say that the major turning point was the impact of COVID because it made me think about myself. Because first and foremost, I am a patient, with lived experiences just like everyone else. But whenever I seek care, you know, I'm stepping into a system that often doesn't fully see or understand all the parts of who I am, whether that's biological, that's, behavioral, social, or what the, my environment may be. But like all those pieces are deeply interconnected and if they're not acknowledged or addressed when I walk into accessing our healthcare system, then I may be walking away without the care or the support that I truly need to not only improve, but even maintain my own health. So, this is really where the passion for me was ignited when I realized we need individuals to truly champion this work, and I needed to do my own part. As I've been in this healthcare space for a number of years, I've just learned more and more about how um, undersupported, underfunded the primary care sector is. And the way that I have used it personally, it was just very surprising to me whenever I seen these, see the reports. And I've learned, through, within the coalition space and through our partners about what was really going on within our healthcare system.
As we're sitting here talking about, the patient experience, which I think is really what drives most folks into this work, I'm curious, could you tell me a little bit about how the National Alliance is working to improve that patient experience, especially in primary care settings?
The patient voice and those lived experiences need to be front and center, right? We can't lose sight of that. And in some cases, it it's been part of the work, I would say, but we need to be honest about whether we've drifted away from that. And look at the real progress that has actually been done because one, it requires patients and partners from the very beginning to be working together, right? So the ways that we have really tried to push this forward in the primary care space is that we educate the employers on the alternative payment models that are available to them. We spotlight employers who are making significant progress as an example to say to others, um, you could do this too, no matter what the size you are. So we've taken steps to just truly partner with the health plans, and even seeking out in providers, hoping that unifying them and engaging them, as diverse stakeholders would help to promote policies and, really share the best practices that support the adoption and growth of high performing primary care. Uh, the employers in this space that I've really seen be trailblazers are the ones that have said, we're going to bring this on site. We are going to make the investment in primary care. And the way that they do that is by providing those resources that are readily available on the job, where their employees are able to tap into while they're there. They don't have to set up an appointment and drive, 10 miles or whatever, distance. They have resources. They are bringing a team, a clinical team, on site to help them. And the way that they've done that has really reduced not only the cost, but it has provided tremendous value to their employees.
Kind of expanding upon that, what drove the National Alliance to move into this work? I mean, how do these growing challenges that primary care face impact employers, and why should they get involved in efforts to strengthen primary care?
The strong primary care is just foundational to helping people manage their health and before it actually becomes a crisis. So when, employees, as I was talking about, just even personally, whenever I enter a system, but when an employee enters the system through primary care, they're more likely to get those preventative services and avoid, any unnecessary ER visits or even reduce any type of like hospital stay that they may encounter down the road by not addressing their healthcare needs. And that is the way that we really move towards better health. And it's also will impact the bottom line for employers. But one thing I would also like to call out is that this creates a real opportunity for employers to just show up in a real and lasting way. Employees remember how they are supported during vulnerable times. We've seen it in the pandemic. And then also their families do too.
Thinking about it a little bit more broadly, if you could emphasize one major message to policymakers, to thought leaders, other experts out in the health world that are helping shape what hopefully will be a brighter future for healthcare, what would it be?
If we're truly serious about strengthening primary care, then we have to move away from fee for service models. Fee for service models fragment care and they award volume over value. Right now, we're paying for every appointment, every test, every prick of the needle. And in doing so, we're actually undermining whole person care. And, to that end, it goes back to what you just said, Todd, is that primary care should be about relationships, coordination, and prevention, not transactions. Like, we need stronger, more intentional actions. And that means that the federal government, I mean, just stepping in to set a standard. And I know that PCC is really advocating for a hybrid payment model. And we full-heartedly support that because it not only provides a cap on prices, but it allows there to be some flexibility.
Moving on to our last question here, and it's my favorite question. It's never a fair question, but it's one I enjoy asking. I love hearing everyone's dreams and hopes. If you, thinking broadly, if you could wave a magic wand and you could change one thing about the American healthcare system overnight, what would it be?
Transparency, just greater transparency. Um, it's a black box. I mean, there's so many things that I hear from, employers, because they don't have access to their data. They don't have true insight into what it costs for services. And it's a problem. It's a huge problem. And it's one that, that we've been advocating for years, and we still haven't seen the needle move, right? Even though employers are making attempts every day, but the reason why I say transparency is because that if employers had access to their own data, they could better understand how to design their plans to meet the needs of their employees and their families. And, without this access to just the meaningful cost and quality data, how can you truly reform a system that is broken? How do you expect employers to step up and say, this is the way forward? This is what we can do if they don't even know truly what's happening in that black box? So, real access to data that helps them get to more informed decisions regarding not only their plan, but their network. I mean, and even to allow them to be able to access better prices.
Well, Christina, thank you so much for joining us, and we are thrilled, as I said, to have you in the National Alliance and the PCC membership and the PCC family. And thank you for all the phenomenal work you're doing, and thank you for being a primary care champion.
Thank you so much, Todd. I am so delighted for this opportunity, and thank you to the PCC family for all the work that you do each and every day.